Ladin Sign, the early pregnancy detective work. Okay, let's dive into this. Have you ever actually stopped to think about just how incredibly smart the human body really is? I mean, way before a person might even remotely suspect they're expecting, their body is already putting in the overtime. It's shifting, it's changing, and it's leaving this tiny, almost invisible trail of clues. So in this explainer, we're going to look really closely at one of those super early hidden signals of pregnancy. It's basically this fascinating piece of medical detective work that happens right at the very beginning of gestation. We're going to explore exactly what happens when the body starts dropping these massive physiological hints, long before you ever get an official confirmation. It honestly just makes you appreciate the silent, totally complex language of human biology. So that brings us to a really fascinating question. How can we tell someone is pregnant before standard tests are even run? I really want you to frame the early stages of pregnancy, not just as, a medical condition, but as a true physiological mystery. Healthcare providers essentially have to act like medical detectives here. They're actively looking for these physical clues that tell a story about what's going on deep inside the body. Before the era of those instant at-home pee sticks or high-def ultrasound imaging, these physical clues were literally everything. And even today, they form this totally fundamental baseline of clinical assessment. Practitioners rely on their senses, their training, and quite literally their hands to decode the subtle whispers of the body. It's kind of an art form just as much as it is a science. And the very first major clue in this whole mystery pops up at a highly specific number: 6. Yep, exactly 6 weeks. Right around that crucial 6-week milestone of pregnancy, a very specific, totally physical change occurs. Now, this fascinating little clue was identified by and named after Dr. Louis Ladin. He was a Lithuanian-American gynecologist, and he discovered that at this precise 6-week mark, a distinct anatomical change happens. It's honestly an incredible testament to just how predictable human biology can be, right? The fact that we can pinpoint this exact change to such a specific time frame is wild. It acts as this early, predictable milestone that serves as a giant flashing indicator for our medical detectives, pointing them toward what might be happening completely out of sight. Now, what's really interesting about this slide is the exact definition of what Dr. Ladin actually found. So what exactly is Ladin sign? Well, it's defined as a soft midline spot found on the anterior uterus. But you might be thinking, how does a practitioner actually go about finding a quote-unquote soft midline spot? Well, they assess it during what's called a bimanual pelvic exam. During this very hands-on examination, the healthcare provider is physically feeling the structures of the pelvis. They're checking for size, they're checking the shape, and most importantly for us here, they're checking for texture. The anterior, or the front part of the uterus, develops this super specific, soft area right smack in the middle. Imagine feeling a really firm muscle, and then suddenly you hit this distinct, softer, almost doughy spot right in the center. That tactile difference, found through a really careful physical exam, is the absolute hallmark of Ladin sign. It's this remarkable physical manifestation of new life. But why does this happen? I mean, the body doesn't just change its texture for no reason, right? And this brilliantly illustrates the whole physiological why behind the clue. When we look at why this softening happens, it really boils down to two massive internal shifts: increased vascularization and rapid hormone changes. Literally from the moment of conception, the body undergoes an extreme transformation. There is this sudden, massive increase in blood flow. That's the vascularization part we're talking about, and it's specifically directed right to the pelvic region to support the developing pregnancy. So you combine all that extra blood flow with the rapid, sweeping hormonal shifts that are kicking in to maintain the pregnancy, and the tissues of the uterus respond physically. It's the sheer volume of new blood and the powerful influence of these hormones that literally cause the tissue in that anterior midline spot to soften up. It is just a beautiful, highly orchestrated biological response. So the crucial point is understanding exactly how we categorize this clue in the medical field, because, any good detective knows the difference between a strong hint and absolute proof. In the medical world, we categorize a clue like Ladin sign as a probable sign of pregnancy. Its presence heavily suggests that a patient might be expecting, but, and hey, this is a major distinction, especially if you're taking notes, it is absolutely not definitive. Why? Well, because similar tissue changes, like a similar softening, can actually pop up in other non-pregnancy related conditions too. It's a very strong hint, for sure, but it's not absolute proof. To get positive, rock-solid proof of pregnancy, we really need confirmation through additional testing. And by that, I mean looking for the presence of the hormone HCG with a dedicated pregnancy test or getting visual confirmation with an ultrasound. Those tests give you a definitive, positive yes, whereas Ladin sign, it just gives you a very strong, highly educated probably. Now, if exploring these physiological mysteries is something you're currently studying deeply, especially if you're a nursing student staring down those intimidating maternity rotations or prepping for the NCLEX exams, there are some truly great resources out there to help you master this detective work. Understanding the nuanced difference between a probable and a definitive diagnostic milestone is absolutely essential for your practice. So, to help you nail these exact concepts, Nurse Sarah from Registered Nurse RN has actually put together a fantastic, comprehensive study guide. It is an amazing resource to help you prep, and you can grab it in whatever format works best for your personal study style. It's available as a digital download right over at nursern.com, or, if you're like me and you prefer to physically highlight and turn actual pages, you can pick up the paperback version on Amazon. Utilizing structured resources exactly like this is, hands down, the best way to lock in those critical medical detective skills so you can confidently apply them out there in the real world. As we wrap up this explainer, I want to leave you with something to really deeply ponder. We've just explored how one specific soft spot on the uterus at exactly 6 weeks can hint at new life, and it's all driven by this hidden internal rush of blood and hormones. It really makes you wonder, doesn't it? What other completely hidden clues might the human body be sending out right now that we haven't even fully decoded yet? The sheer complexity of human biology and the endless, ongoing detective work of medicine it's truly boundless. So keep questioning, keep observing, and absolutely keep that enthusiasm for learning alive. Thanks so much for joining me on this explainer, and I'll catch you on our next deep dive.